Hello everyone, welcome to the Health Ed channel. 10 things everyone has to know about stroke. Number 1. Stroke affects 1 out of 4 adults. Statistics have shown that the lifetime risk of stroke for adult men and women 25 years and older is approximately 25%. It is the second most common cause of mortality and the second most common cause of disability, accounting for 11% to total death. There are around 800,000 cases of strokes in 1 year in the United States, which equates to more than 2,000 people affected every day. Just imagine how common that is. 1 in 4. It could be your friends, your family, or even yourself. So be sure to watch the video till the end so you know what to do when facing stroke or how to prevent it. Number 2. Not all strokes are the same. Stroke is an emergency situation when a part of the brain dies due to either blockage or bleeding from the blood vessels supplying the brain. They are classified into 2 major types: ischemic, which means reduced blood perfusion, or hemorrhagic, which means bleeding. 80 to 90% of stroke are ischemic, while the other 10 to 20% are hemorrhagic. It is important to differentiate the two, as the managements, as you could imagine, are exactly opposite to each other just as their causes are. Number 3. Time is brain. Studies have shown that around 2 million brain cells die every minute in which a stroke is untreated, which equals to around 3.6 years of normal aging every minute. As brain cells are difficult to regenerate, it's important for people having stroke to receive timely treatment to minimize the damage to the brain and the subsequent disability. So whenever you suspect stroke, do not hesitate and call an ambulance. Number 4. Fast. There are 2 meanings in it. First of all, you need to act fast when facing a stroke. And second, it is a synonym for the common features that a stroke patient would have. Stroke sets in very quickly, so everyone has to be aware of its symptoms. Face. Your face may droop on one side or it may look uneven. Arm. You may be experiencing weakness or numbness over one side of the body. Speech. You may have trouble speaking. Time. Act fast. 1 in 3 Americans can't name even a single stroke warning sign. Now you know 3 salient features, you are more equipped than most. And more importantly, it may even serve to save yourself or your loved ones next to you. Number 5. Stroke most frequently occurs in Monday morning. Statistics have shown that stroke is 15 to 20% more likely to occur on a Monday. And there is a 50% increase in stroke of all types between 6 in the morning to 12 at noon. There are multiple possible explanations, including circadian or postural changes in blood pressure, heart rate, stress hormones levels, so on. It is postulated that the idea of having to go to work increases your stress level and contributes to that. Cause guess what? The lowest incidence of stroke is found on Saturdays and Sundays. Number 6. Mark the onset time. When facing people having stroke, we doctors are obsessive on the onset time. That is because there are treatment windows for different treatment options. For ischemic stroke, a drug called TPA, stands for tissue plasminogen activator, a drug used to dissolve blood clots, could be used if the onset time is within 4.5 to 6 hours. While mechanical clot removal could be used within 6 hours to up to 24 hours. So it's important that you should mark the onset time of stroke, as it would guide the decision on which treatment suits you most. An important concept when determining onset time is whether the stroke is witnessed or found. When it is witnessed, then the time is the exact time the symptoms kick in. However, if it is found to be present, say in the morning after wake up, then you would need to trace back to when last seen, well, maybe last night before sleep or in the midnight when you go to the washroom. Number 7. Stroke may be temporary, but that does not mean it's insignificant or less severe. TIA, which stands for transient ischemic attack, is a term used to refer to a temporary stroke. It happens when a vessel supplying the brain is temporarily blocked by clots and then reopens on its own as the blood clot dissolves or flows away. Symptoms are the same as stroke, only that it does not persist. It's important that you still have to seek medical attention, as doctors may prescribe you medications to prevent future episodes of stroke. Indeed, you should consider yourself, quote-unquote, lucky, as the attack gives you a chance to treat and prevent the next attack while not causing lasting brain injury. So do not miss it. Number 8. Some basic information on CT brain. CT brain is an imaging of the brain which is an essential first-line test for people having strokes. It is used for diagnosis of stroke and for differentiating ischemic or hemorrhagic causes of stroke. Here are two illustrations of CT brain films. The one on the left shows a darker area, which is where the reduced blood flow to the brain is. The one on the right shows a bright white area, which is where the bleeding occurs. Besides CT brain, doctors may perform blood tests, heart tests, and other imaging studies to guide subsequent treatment. Number 9. Know your treatment options. Treatment of stroke depends on the type of strokes that one is having. Ischemic stroke is when there is reduced blood flow to the brain due to blood clots, so treatment options include giving drugs to dissolve the clots or use a catheter through the vessels to mechanically remove the clot. As the brain swells during stroke, in cases where the stroke affects a large area of the brain, surgery may be needed to release the pressure within the skull. For hemorrhagic stroke where there is bleeding, drugs may be given to stop ongoing bleeding or reverse the effects of blood thinners if these are in your usual medications. Surgery is the mainstay for hemorrhagic stroke. Whether or not surgery is needed depends on multiple factors, including the extensiveness of bleeding, its location, responsiveness status of the patient, so on. Despite its acute nature, it is also important to bear in mind that stroke is a lengthy battle. It requires a long journey of rehabilitation with physiotherapist, occupational therapist, and speech therapist to recover from disability. Number 10. Healthy habits and good control of disease help prevent stroke. It is shown that 80% of strokes are preventable. There are actually a lot of things you could do to lower your chance of having stroke. Leading healthy lifestyle including no smoking or illegal drug use, limit the amount of alcohol, regular exercises, eating a diet with less salt and fat would serve you well. Taking your medicines and have good control of high blood pressure, diabetes, high blood cholesterol and heart disease also play a role. The main takeaway is that stroke is a very common condition that affects 1 out of 4 adults. Remember stroke symptoms by FAST, and don't forget to recall the onset time of stroke. Leading a healthy lifestyle could minimize the chance of having a stroke. If you think this video is useful, share and spread its information to your friends and family. It may serve to save their lives. Reinforcement is the key to learning and memory. So if you think you have learned from the video, type FAST in the comment section. Or you could comment on what medical illnesses you want me to cover in my videos. Thank you for watching till the end. Be sure to like this video and subscribe to my channel. Your support is vital in motivating me to continue my work on spreading useful health info. See you next time.